And welcome to Chentex Multimedia live stream for today, an Australian Indian radio production. Well, it is the 30th of April, meaning last day of April, and this year is ticking past. Well, today we have lots to cover in this segment. We have the interview with Arpit from GOPIO, Queensland. We also have the interview with Ribbonite coming on as well. And there's all these news and events that are taking place as well. But before we look at that, hey, it's Friday and the weekend's coming on. And it's not only a weekend, it's a long weekend as well. So let's take a quick look at what's in store for the weekend weather-wise. So with that, let's welcome to Dilraj.
Good morning everyone. Weather forecast for the rest of today is maximum 25 degree. Brisbane area is partly cloudy with very high chance of showers. Light winds becoming southeasterly 15 to 25 km per hour in the middle of the day and then becoming light in the evening. Fire danger is low to moderate. Sun protection is recommended till 10 past 2 in the afternoon and UV index is predicted to reach 5, that is moderate. Over the weekend, minimum will be 17 and maximum will be 25. Brisbane area will be cloudy with high chance of showers. Light winds becoming southeasterly 15 to 25 km during the day and then becoming light in the late evening. Sun protection is recommended from 10 past 9 in the morning till 10 past 2 in the afternoon and UV index is predicted to reach 5, that is moderate. Till tomorrow, stay safe and enjoy the rest of your day.
And thank you very much for that update, Dilraj. As we know that this is going to be a long weekend, and when we look at all the things that's happening in India, so there's a lot of things that have been planned, around Brisbane. There's that candlelight vigil that has been planned in Robail Domain. And of course, there's other things in the pipeline. We'll send you out the messages of what's happening in that. But right now, let's take a quick look at the breaking news and all the news headlines.
Sluggish COVID-19 vaccine rollout will be front and centre when state and federal leaders meet today. 82,000 vaccines were administered yesterday as the program gets ready to ramp up next week with anyone aged over 50 eligible for the jab. It comes as the drug regulator has again called for calm, saying there does not appear to be a link between the AstraZeneca jab and the deaths of 2 men in New South Wales. The former Liberal staffer who sparked a nationwide movement about the treatment of women will meet face-to-face with the Prime Minister Scott Morrison and opposition leader Anthony Albanese today. Brittany Higgins became the face of a campaign for cultural change after alleging she'd been raped by a colleague inside Parliament House 2 years ago. Tasmanians head to the polls tomorrow as candidates use the last 24 hours to sway as many voters as they can. Premier Peter Gutwein wants to secure a third term in office for the Liberal Party, while Labor leader Rebecca White hopes her health and housing pitch is enough to take the top job. Across Perth and the Peel region, cafes, bars and pubs will return to pre-lockdown capacity and 30 people will now be allowed inside homes. But for the next week, masks are mandatory inside. And healthcare workers, police and firefighters will be among those receiving their COVID-19 jab at Adelaide's first mass vaccination hub from today. The clinic at the Wayville Showgrounds opens its doors this morning as part of a vaccine rollout ramp-up.
So they are up to date on Australian Indian Radio, and as we know that at this point in time, all eyes are on India and looking at what's happening and what can be done. And it is so good to see that there's been so many countries which have come to the aid by sending supplies by their channels. As we know that all on the ground, small community organizations can do their bit as well. Everyone can do their bit. Every little bit counts. But where it really makes a difference in a timely manner is when there is a government-to-government support with all the mechanisms in place to deliver goods in ASAP, cutting through the red tape and getting things there. So, as we know, with small community organizations, by the time we send things and they reach there. I'm not saying that they won't be needed, they will be needed, but as time is of the essence, I would say that at this point in time, government to government aid is probably the best way to go forward. I've been speaking with Department of Foreign Affairs and Trade, and of course, if anyone is in dire stress and if someone needs urgent answers about anyone who's stuck, we can provide that link directly. It will be easier talking to someone directly rather than going online, which is always a preferred method, but under the current circumstances, I have been reassured that, I will be able to channel your inquiry if it is DFAT related to DFAT, and you'll get an opportunity to talk to someone directly there. Well, right now, let's go to India and let's take a look at as the number of cases, active cases, reaches a whopping 18 million.
Harshit Kathar's grandmother is in hospital with COVID-19.
If we don't give oxygen, she will die in hospital. Hospital say no oxygen.
He's willing to make the hour-and-a-half journey to deliver it himself.
It is very far and no one is allowed to go inside.
Confidence in India's frail healthcare system has been shattered as the country drowns in the virus.
You don't even get to see the body of your loved ones, and sometimes bodies are switched.
Residents are being forced to fend for themselves. Many scramble to secure oxygen from volunteer groups and buy it from the black market, where it can sell for exorbitant prices.
We came here around 5 this morning, but there were others who've been here since midnight.
Hundreds of people are coming here each day. If we had help from the government, we could do so much more.
Out in the slums, hygiene is poor and social distancing is simply not an option.
This is the shanty where 7 of us live. There's less than 30 centimetres distance between us.
There's no escape from an outbreak here.
I've stopped watching the news out of fear. I'm so scared. I feel I'll die after watching.
Despite the obvious calamity here in India, there's concerned efforts are being made to suppress the true story. Facebook and Twitter have complied with directives to take down posts critical of the government and Prime Minister. In Gujarat, deaths in major city hospitals far outnumber the official death toll, raising alarm about under-reporting. And in Uttar Pradesh, the Chief Minister has not only repeatedly denied a shortage of oxygen, but threatened legal action against people who make such claims.
There is a trust deficit, a huge trust deficit between the people and the government. The system has collapsed.
There is gross under-reporting. It's happening in almost all states of India.
International medical aid is now trickling in and more lockdowns are being hastily imposed. The scramble for solutions is only just beginning. James Oaten, ABC News.
So, ladies and gentlemen, once again, welcome to this very, very important segment. And today we're going to be talking about some of the things which is very, very important within our community. Many times, topics such as these are swept under the carpet. People don't want to talk about it. But right now, in the studio with me is Arpit. Arpit, welcome to the show.
Thank you, Meshi. Thank you for having me.
And it's wonderful to see you here today. Okay, so as I've been told that mental health awareness is going to be taking place. So could you tell us about when it is going to be taking place and how did it come about?
Thank you for having me, Umeshi, here. This mental health awareness event is the first ever event that GOPIO Queensland is organizing in the mental health space, because we felt there is a need of awareness in our community and in the public in general. We should be talking about mental health like any other bodily issue, and we need to address it before it gets worse. A lot of people are not aware about it, and they're not aware of the severity of it and how it should be tackled. That's why we are organizing this event, which is sponsored by Queensland Mental Health Commission, which is a body of Queensland government. It's also supported by Black Dog Institute. We will be having a presenter there from Black Dog Institute presenting a whole talk about breaking down depression and how it should be looked at, and how we can help people who are suffering through any mental health illness. It's happening on the 29th of May at QMC Kangaroo Point. It's a good auditorium, amazing facilities. We will be. It starts from 5:30 and ends at 9 p.m.
And thank you so much for that the information. Well, the two things you have talked about. One was the Queensland government's mental health section, and the other section was the Black Dog Institute. So, we'll go one by one. The first, Queensland government's mental health section. So, what is that division and what does it do and how did it come to be involved?
Queensland government, as we all know, has been handling the COVID crisis quite exceptionally well, and they have a dedicated team that looks into the mental health space and the awareness that needs to be spread out into the community. Their offices are in Brisbane City and everywhere else. It's called Queensland Mental Health Commission. We as a community organization, we reached out to them for support of this event, and they were extremely welcomed our event and the initiative, and they are sponsoring the whole event, and we are glad to have that their support in our event.
And it is always good to have that kind of support, because as we know, without the support, it is very, very hard to make events come together, because there's many kinds of costs that are involved, and coming on board like that, the government coming on board is a great achievement for GOPIO, and I think it's a testament to you to having arranged that. Now the other one you talked about is Black Dog Institute. Many of our viewers and listeners might not know about Black Dog Institute, so could you tell us in a nutshell what that is?
So Black Dog Institute is a very prestigious and old organization. They have been working in researching the mental health issues, why they happen, what happens when someone goes through any mental health issue. They are a big name in this space in Queensland and all over Australia, and their approach to mental health illness is always evidence-based. So all their presenters, all their presentations are evidence-based and well-researched. And the speaker, the presenter that we're going to have in our event, his name is Peter Ferreira. He's got a lived experience of depression, and he will be presenting a presentation on breaking down depression. And that whole presentation will be evidence-based. And being, in a first world country, we have to have a backing to what we are saying. And I appreciate the amount of research that Black Dog does behind whatever they say, whatever they write, and the whole presentation is going to be backed by facts and evidence. So Black Dog is a big name in this space. It's just like Beyond Blue. Beyond Blue has got a phone service, but Black Dog is working behind the scenes and researching everything.
And that is wonderful. And as you mentioned that the presenter will have a lived experience, and I have found working with in the DV space with White Ribbon that many of our presenters who come on who have had a lived experience, their presentation is always so strong, it's so engaging, so compelling, and it really connects with the audience because they are not just there saying they have been through that and they know what it's like to be. So it's good to see that that's happening. And of course, GOPIO, which is the Global Organization of People of Indian Origin, as the organizing body, and Queensland Multicultural Centre, which is otherwise known as BMAC. Everyone knows that. Under the Story Bridge is where this is taking place. Now, also you mentioned about the mental health and how people are not aware of many things. Now there's always to and from, many times people speak about many things, and this happens in any space. When we do, I'm just referring many times to domestic violence because I'm involved with White Ribbon, so I know there. And many times we come across things, people say, why do you people even discuss it? By discussing this, you're bringing it out to the community. People who didn't know, things that were not happening will start now happening, and things like that. So why is it important to make that awareness, to make people aware of this situation?
So Meshi, that's a very good question, and obviously there are so many reasons why we should be talking about it. One being the realization and being able to help someone before it gets worse, because if someone doesn't know, if awareness is not enough, and if not many people are aware of the different kinds of illnesses, they won't be able to help each other out. And obviously in this fast-paced life and with so much pressure on each and every individual, everyone goes through some sort of mental health problem, and it's the awareness will help that person and the people around them to recognize what's happening, what's wrong with that person. I wouldn't say wrong, what's not normal, and then they can reach out to that person who's suffering, or the person can reach out to their friends or family, or preferably a professional, and then they can seek help and prevent themselves from getting worse. So it's so important to catch it at the initial level and just remedy it. And it's nothing that we shouldn't talk about. Why shouldn't we talk about it? It's just a normal illness. It's just the society that's attached this taboo and stigma to it, but there's nothing wrong in talking about it. It's definitely an illness that can be cured, can be managed, and can save lives, and the quality of life if addressed at this right time.
And you rightfully mentioned that addressed at the right time, so that is very important. And of course that stigma that you talked about in the community, many times people say that these things should not be talked about and things like that. So as you mentioned, as the whole topic says itself, the topic and the title itself is mental health. So it means health. So we, even though reference many times is made to, that this is a, illness that can be cured, but health, in any kind of health, if, same as physical health, unless you practice and other things, unless you are physically fit, many times you will lose your physical health. So as long as your physical health is important, I think mental health is equally important as well, and sometimes even more so. If you are mentally prepared, there are many things you can do in life. You can, if you have that mental block and in your mind, then many things if you set out yourself to achieve in life, you can't because of that. So I think it's a very timely event which is happening. Of course, many people are not aware of the numbers and other things. Many things are not reported. So is the case in I keep referring to domestic violence because that's the space that we've been working in, and the facts and figures that come out we know for sure that there are much more cases happening out in the field which have not been reported. So many times the stats might not be 100% up to date because of that, what you mentioned, that people do not want to come out and talk about it. So I think it is very, very important. The topic is very vast, meaning, the mental health in itself, there could be many different segments there as well, many different aspects of it, of course, different levels of it as well. Where does it start? Exactly. Is it just stress, depression, or where is it going? And of course, looking at if it's not treated, where do people end up? So, unfortunately, all those things. So all this will be discussed in this mental awareness seminars. So once again, how do people come to this event, and how do, if anyone is interested in attending, what do they need to do?
Yes, so Meshi, I think I missed to explain the schedule of the event because there's a very important and exciting part of the event that I would like to, say. We are having a live theater play performance at the event, and that's what I'm really excited about. And a lot of my friends and circle people, they're all excited to see a live show, and the performance is obviously along the same theme. So it's a 30-minute short play on mental health awareness and how to seek help. That we'll be having that, and also there'll be food from Kulcha Culture. So people are excited about that as well, and surely I'm going to be having that food because I love Kulcha Culture. So everything is included in the price. The ticket price is $15 per person, inclusive of the theater performance, the whole event, and the food. It's a vegetarian meal. I'm not sure if I have to mention that. And it's there's a link on GOPIO's Facebook page to click on and get your tickets. So please book your tickets as soon as possible, because due to COVID, obviously, the capacity is limited. So we've got limited seats. It's obviously based on first come, first serve basis. So let's book our tickets as soon as possible and make this event a successful one.
And the event will be successful, I know, because it is for the first time that GOPIO is presenting this, and it is something which is the need of the moment. I mean, it needs to be discussed, as you mentioned there. So, ladies and gentlemen, there you are. For $15, you get the attendance, which is, and of course, as Arpit has mentioned, that it's a 30-minute play. And I think that's a very good way, including arts into that and performing art to explain the mental health and mental health issues, and upon reporting on that. As we know that a similar event in a different field on child abduction is happening, and again they've chosen the medium of acting, and so the stage acting to present that. And here's the link on the screen, and this is the link, and you can search GOPIO Queensland and the website and the Facebook page. The links will be available on, and as Arpit has mentioned, that it is on a first come first basis. So please, you don't want to miss out on this event to find out what's happening, because it is very, very important that we get this message out into the community. Many times even people talk about, or someone who's getting a little bit older might have mental health issues, but it's not that. It could start at the early age as well. So prevention is better than cure, and it is always good to know rather than not knowing what it is. The symptoms are very, very important. Once you know the symptoms, and the correct diagnosis, then only treatment can be, based upon that findings. So it is very important that we find that. So once again, Arpit, thank you so much for coming in today and discussing this. Wishing you all the very best with this event. And I know that you have really, really worked very hard, and you have made everyone in GOPIO very proud that you have been able to put together this event.
Thank you so much, Meshi. Thank you for having me. Thank you for all your support. And he's going to be there as well. So you'll get a chance to meet Umeshi, the man, face to face. So don't miss this opportunity. We would love your support.
We'll see you all on 29th of May at Queensland Multicultural Centre for the mental health awareness presented by GOPIO Queensland. Thank you very much.
Thank you.
GlobeNet Realty. GlobeNet Realty has been the longest established, trusted and respected agency in its trade area. Washa Chandra, Director of GlobeNet Realty, provides honest and ethical service to her customers. If you are thinking of investing in Brisbane real estate market, or if you are seeking professional property management, then you should contact Usha Chandra today on landline 3865 4466 or mobile 0419 775 416. And for further updates, log on to our website www.globenetralty.com.au. GlobeNet Realty is your own local real estate agency. Situated at Shop 52281 Sandgate Road, Boondall. GlobeNet Realty. Real estate is our world.
And real estate is the world. And don't forget that every Wednesday they bring to you a live update of what's happening with the property scene and what's happening in the property market. As we know that what USA has reported in there has the rising prices. So here's a clip of what's happening actually in Byron Bay and property-wise.
I sit at Main Beach or Watergoes and look out over there towards Mount Warning and it still blows me out. It's just so beautiful. God, how was that sunset yesterday afternoon?
Yeah.
Spectacular.
Max Pendergast has been doing a daily surf check around Byron Bay for about 70 years.
It's a nice way to start the morning. Hello, there's a wave.
The view is consistently spectacular, but his hometown has undergone a dramatic transformation.
Yeah, a lot of the shops have all had facelifts and changed, and the people, like I say, are just clutter. There's just so many of them walking and on the beaches, and basically everywhere is just crowded.
You'd never know it now, but up until the 1980s, Byron Bay was an industrial, working-class town.
Fathers, sons, mothers and daughters, whole families worked here. Many have known nothing else except the abattoir.
That's it. See you later, FJ.
And the only prospect for them now is to go on the dole.
We're all going on a summer holiday.
It was a funny town because it had the abattoir, and then it had a whaling station, and then it had sand mining and Norco's big dairy company here. And people didn't want to come here because it smelled. You know, it smelled of the whales, it smelled of the meatworks, you know. Frankly, I wish it still did.
Byron's beauty has become a double-edged sword in recent years, with its popularity soaring and the local community paying the price.
We'll sit outside for a while.
Yeah. Did Mum go for a surf?
No, she's had enough surf today, I think.
Kira Pendergast relishes the chance to catch up with her family, but is not willing to pay the money being asked for accommodation in the place where she grew up.
I've seen friends having to leave this place, like literally in droves, to move out to up to an hour away and still work in Byron.
Second Councillor Njai, put that to the vote. All in favour. Okay, thanks, councillors. Okay, so we've got councillors...
It's meeting day for the Byron Shire Council, and a motion from Mayor Simon Richardson has attracted international attention.
I was speaking to NBC yesterday, New York Times tomorrow.
Streaming giant Netflix wants to film a series called Byron Bays, focusing on the social media influencers who have now flocked to the area.
Yay! Some of those have to be good.
Producers of the so-called docu-soap have been met with a wave of community opposition from those who fear the town's reputation could be tarnished.
The content delivery is very unknown, and it has all the hallmarks and potential to be quite vapid and vacuous. We are very, very, unappreciative of this sort of thing coming to us.
Bundjalung woman Delta K knows the town's popularity is key to the success of her cultural tours, but is no fan of the proposed reality TV show.
Isn't this stunning? What do you say? You know, we're continuing having people come here and use the Byron Bay brand for their own gain. It's quite frustrating, and it's not who we are.
A native title claim for the Byron Bay area was approved in 2019, but the concept of traditional ownership only goes so far.
Out of, over 100 people.
And this is the sign of times, and this has been happening in many places all around the world as well. The good old places, all of a sudden, everyone else starts flocking to it. Look at Australia, when we came here, there were very few people of Indian origin. If you saw someone, it would be different. But now, there's that many people. So, Byron Bay, once again, a quiet little nestled out place. But right now, everyone's flogging in there, which is had an impact on the locals, or the people who used to live there in their own little way. That all changes because you're not used to seeing those many crowds, and the lifestyle completely changes, not by something that you have done, but something which has just evolved around you. And of course, that has had an impact on real estate. The prices have just shot through the roof, and the locals, they are no more able to afford those prices which are exorbitant, and have to move away, as was said in the report, about an hour away sometimes, and come to work in Byron Bay. But as they say, you can't stop progress, and things will change. You need to adapt with the times and move on. Well, right now, for the last interview for today, we talked to River Knight. See if I can get him on the phone. Ladies and gentlemen, you're listening to Australian Indian Radio, and once again today we are going to be talking about some community-related topics, as we know that their disabilities could be in many forms. Adapt and reconnect. A lot can be done for disability community to adjust to a new normal. 250,000 Queenslanders need assistance in self-care, mobility and communication. COVID has changed the way disability support is delivered, meaning providers need to adapt and change to suit the needs of individuals. Australian Foundation for Disability, Afford, has launched telecare and opened 20 new disability support services to meet the sector's increased needs. Developing Australian communities invites families and individuals to have their voices heard. And of course, as we know, that with all this, there's so much that's happening out there in the community. And to talk to us more on this topic, we will soon be joined by River Knight, the CEO of Australian Communities. River Knight is the CEO and founder of Australian Communities, with more than 22 years in disability, mental health, education, child safety, youth justice, quality systems and forensic settings in government and non-government sectors. He's done a lot, as well as lived experience of disability. River Knight is an expert in raising the bar and helping 24/7 NDIS funded participants. So welcome to the show and welcome to the station, River.
Hi, thanks for having me.
And of course, when we know that you are probably out at the expo today, but can you tell us how the disability sector has changed across Queensland since COVID?
So we've seen quite a few different changes. So we've had a lot of services that were restricted in terms of people being able to go into people's homes to make sure that we keep people safe, especially around that transmission of COVID. The other thing we've seen is some of those services have tried to work with just e-health versions of appointments. So some of that works really well for some types of contact, but for a lot of people with an intellectual disability, for example, you can't really replace a lot of those therapeutic services with e-health. telehealth because they really need the face-to-face. So we're now getting back into a space where we can actually reconnect and do that face-to-face. And then some of those programs like what Afford are rolling out also really help to connect people as well in terms of the telephone contact.
Well, it is very, very timely as well, you said. But, why is now the perfect time for tackling this issue?
Well, because we've had such a year of disconnect in 2020, we really need to get back into the new year and just connect people back with services that they've lost, find options, but also those people that are continuing to apply for NDIs and get approved all through 2020. A lot of them found that services weren't able to accept new referrals because they couldn't do the face-to-face. So there's a bit of a backlog that we're catching up on, and we need to be able to find those services in a nice, easy, personal space where people can really talk to each other and decide who they feel comfortable with. So it's a great time to be able to create a huge space, and that's why we've got our expo down here at the Brisbane Convention Centre at Southbank on the Friday and Saturday this week.
Okay, so, looking at all this approach that you said, it is very, very important to be able to find that, we know that all these things are there, so it could be a minefield out there for many people boggling, trying to get to that information. How should service providers change their approach to make reconnecting easier with the disability community?
Well, what we're finding is service providers have really had the opportunity to look at what's really important and what do we need to spend time on. And one thing I've enjoyed is we've certainly been able to identify with service providers and government how many meetings that we have that we really don't need to be having. We could easily do on email and face-to-face. So I think it's been actually an interesting experience to see how people connect and feel comfortable with service providers, but also that redundancy of, well, when there is a problem, how do we make sure we deliver those essential services still so people aren't put at risk?
Well, that is very, very important, as you have just mentioned. So what advice do you have for families who are struggling to adapt to the new normal post-COVID?
What we're finding is that families really value being able to connect, reach out on Facebook, reach out on those social media platforms, and also are really looking at ways to find services. So we encourage people to really come along to our expos so that they can see a lot of services all in one spot. But also have a look on our website, which is dacommunities.com, and our Facebook page for developing Australian communities, because we're providing a lot of follow-up and ways for people to connect and really have a voice in the sector.
It is very, very important as well. So where can Queenslanders go to find out more information, and how can they come and attend this expo? So if you can give us a little bit more info on the expo itself.
So our expo is running tomorrow, Friday and Saturday from 10 a.m. to 4 p.m. here at the Brisbane Convention Centre at Southbank, and it's a free expo. All you need to do is register on the way in, or you can register on our website before you get there at dacommunities.com.
Riva, thank you so much for that. So, ladies and gentlemen, please do go down to that expo Friday, and you'll find out a lot more. So, we have been talking with Riva Knight, the CEO of Australian Communities. Riva has spent 2 decades supporting participants living with disabilities, mental illness, and complex behavior, and working with participants who require coordination of a variety of stakeholders, including statutory agencies. Riva, once again, thank you so much for coming on the show and sharing that information with our listeners.
Thanks for having me.
Thank you. And thank you very much once again, Rivanite, for that. As we know, that is happening today. It started today and it will be on tomorrow as well. So if you'd like to go to that expo, please do register, or you can register on your way in when you go there as well. Right now, let's take a look at some of the functions and events taking place in and around Brisbane. Yesterday, we brought to you the travel updates with Tanvi Goyal from OS India Travels. And of course, it is very, very important to get an update on what's happening, whether you can travel to or from India or not. So, the travel ban that's been put in place, has it been justified? Was it called for?
Last week, I lost my brother, who was a doctor, and he was serving homeless patients and people extremely under poverty. He was helping those people.
This is in India, right?
This is in India, in Delhi. He passed away due to the shortage of beds and oxygen in the hospitals. Mismanagement of essential needs has taken his life. The government there is in denial and even is blocking the social media in these issues. Now, the growing crisis in India is like our Australians are there, and then we are worried about them, how to bring them back here. With the conditions they're worsening, the crisis they're growing, I'm worried about our Australian fellows and trying to get them home back to Australia. All I want to know is, why is the Australian government not doing anything in bringing them back? I had some answers from you, but still not very satisfying.
Before we go to them, I'm really sorry to hear of your loss. Your brother was a doctor working with some of the hardest
patients
hit by this.
Night after night, he used to go to the places where these homeless people are, and he used to visit individually. And he was working in COVID clinic, where he got the...
And what's it like for you watching this from afar, seeing all of this unfold, having it touch your family?
It's very devastating, and it's very heartbreaking, and it's like, I just can't explain. Very sad.
I'm so sorry.
I don't want, like, my Australian fellows, not to go under all these situations, and they should be brought home as soon as possible, because the crises are growing. We don't know and they say that peak is not come yet. Peak has yet.
So it's going to get worse. Parnell?
I'm so sorry to hear about your brother, and I agree. I think we need to bring people home as quickly as we can. I think it's so important for the Australian government to say, these are our residents, these are our citizens, and they're in trouble, and we need to help them come home. And I think it's devastating that flights have been cut rather than increased lately, partly because hotel quarantine has been so effective here that we actually could say we can bring people in. Our hotels at the moment are at 50% occupancy. There is no reason why a city like New South Wales, which has handled hotel quarantine very well, couldn't take in those people. Why other states couldn't copy that hotel quarantine approach and also take people. I'm glad that they're bringing Howard Springs online. I'm glad that there are other facilities being built. But we have facilities right now who can help people, and they need to be helped.
But this is also a decision about cutting off flights, right?
Right, and which is just unconscionable. I mean, so they're flying supplies to make vaccine and to provide oxygen to India, and the planes are coming back empty. They need to be coming back filled with people. They need to be coming back filled with people who need help, who can be put in facilities which exist right now and treated. And why we are not doing that is politics. It's down to pure politics. And I frankly don't care whether this is politics at a state level or politics at a federal level. They've got to stop playing politics and sort this out, because this is the Australian citizens. They have a right to come home and they need our help.
So that's that argument there. Of course, everyone has their own views. People are talking about security and other things as well. But, if you are a citizen of Australia, you are a citizen of Australia. And quite rightfully said there as well. Well, ladies and gentlemen, that's about all we have for you in this segment. Should there be a need for another update during the day, we will do that. As I said, we are in talks with Brisbane City Council, the High Commission as well, to see if there's anything that's going to be taking place here. As we know that the There's a Pray for India that's been organized in Gold Coast in Springfield, which is on the Saturday, and you can come there if you so wish. So Springfield Parklands Candlelight Vigil, United We Stand for India, as in one community we come together, and this will be at 55 Ballington Terrace, Springfield Lakes. So just take note of that address. It is in the evening at sunset 5:30, and light up a candle and pray for India. For more information, you can contact Rita Anwari. Her phone number is 0421 251 1986. So, or Dr. Tanya, 0488 994402. So, Springfield Parklands Candlelight Vigil, and that is happening tomorrow night. And of course, the call is that everyone please come and support and light up a candle and pray for India. Well, ladies and gentlemen, as I said, that's about all we have for you in this segment. We have another segment later in the day, we will send out the notification for that. Most of all, this is your long weekend. Enjoy the long weekend. But it is very important that remain safe and observe all those rules, as we know for sure that restrictions are easing. But even then, please be vigilant. Wherever you go, whatever you do, always maintain the social distancing and, of course, observe the rules. Do those check-ins in all the places, not just as a way of doing it. Make sure that it's done properly. Then if you have scanned the barcode that you've gone through and completed and filled in all the details that are required. So, ladies and gentlemen, until the next segment, it's goodbye from me. It's wonderful to have your company here today. And as usual, so good to see you. Until the next time, remain safe.